the We Lead Lounge. Thank you for your patience. We are now going to start the panel. The minister will join us shortly, but because we have back-to-back panels and you also, I don't expect you all to be here forever, so we'll start this panel. So I'm handing it over to the moderator, Pranjal. Over to you, Pranjal.
Waiting for the Bill and Gates Foundation.
He's here. Paul is here. Everyone's here. Come.
I'll request everybody to settle down as possible. I think the success of the We Lead Lounge is the fact that it's overflowing. I'm sure this will inspire everybody to have a much bigger space next year. I'm Pranjal Sharma. Thank you so much for being here. We are discussing a very interesting and a critical issue on not just health and medical research, but really about the very critical talent which drives economic development. And for growth economies like India, I think it's very important that women participate and play a very strong role. And without taking care of health and nutrition, I think that is going to be a failed project. So I'm going to request our speakers here, until our minister joins us, to share some of the perspectives or where things are. Maybe I'm going to begin with you, Paul, and give us a sense on this critical need. There is clearly a lack of previous decades where medical research has, by and large, bypassed the gender diversity that it should have. How do you see this evolving now?
Thank you very much, and thank you very much for inviting me and inviting the Gate Foundation to this panel. And thanks for everyone who showed up here. It's a very busy week, and just critical to see how many people are really interested with this topic of, engendering, gender into health research. And I think when you look from the history, I'm trained as a medical doctor, and then switched to broader development. But even in my own medical education, we learned a lot about the history of medical research, and it's just devastating how, years and decades of research just, forgot about the 50% of the population in terms of, how they set up clinical trials, how they set up, protocols, and how they even looked at, ways of trying, new tools and new technology, and even how the medical research funding and interest really took into account the disease that disproportionately affect 50% of the population. And it's changing now, at least from the Gate Foundation and other who are really supporting women's health. Now it's a field. We do have a whole division in charge of gender equality, and we made a strategic decision to move our MNCH and family planning and gender equality within that division led by Dr. Anita Zaidi. And also we are now really being much more intentional in terms of really thinking about women's health and the research. Because if we don't, then we are just losing huge opportunity for economic development. We all have been raised by women, and we know how many the missed opportunity we have for taking care of our young adolescents. And then down the road, the amount of experience that they accumulate throughout their really amazing lives. And then they get to 40 and 50 where the complexity of their health is even challenging. And there are some diseases that they deal with that is not even considered in the research. While as men, we all know, like breakthrough research on all sorts of things that sometimes we don't even need. But we're really missing endometriosis treatment. We're not even considering some of the menopause treatments that are really providing burden to women in their amazing, productive years. When you imagine how, women, 30, 40, 50, 60, those are that are really driving economic development. So I think we are losing a lot as a world, and it's good that this is changing now, and we need to be intentional. And the last thing I would say is that it's not that we need to change completely the research design. It's just being more intentional, taking gender into consideration, being more gender intentional, that it can even give us more, insight to really solve the problem for both women and men as well.
Well said. I'm going to request now Preetha to come in. I think one of the many lessons that COVID taught us is inclusive nature of medical research. The vaccine, for example, had different impacts on different ethnicities and different communities. Similarly, do you see as leading the healthcare services, healthcare for a global organization, Preetha, that there is shift on the ground and it has gone beyond conversations?
I definitely think it has gone beyond conversations, simply because now there is pressure. Once mankind, womankind, sees the impact of not being prepared, it definitely has now led to a state where people question, we want to take charge of our health, and research centers, institutions, global institutions are collaborating to see how can we take this whole piece beyond. But just talking on today's topic, when it said engendered, if you Google or you look in the dictionary, it actually says making it happen.
Right.
But then the human mind, when you look at engendered, it's the gender aspect which kind of pops up. So I was just, laughingly telling the minister yesterday, I said, I guess they chose the topic very well, that you really have to make things happen for the aspect of women's health. And there was one data point I really wanted to share with you, is that the United States spent 4.5 trillion on healthcare. Which is about $13,493 per person. And this is in direct contrast. We don't even spend $13 in some of the developing countries. So there's a huge contrast there. And then it is 17.3% of the country's GDP. Our GDP, our budget is, and I'm talking India specific, has now gone up to almost 3% of our budget is on healthcare. I'm not even talking about women here. And then what happens is that 30 billion is the amount which is spent on research. And in that, my earlier speaker said it, and we have data points to show that a lot of research, and I don't think we shouldn't get into human rights, or we shouldn't get into this whole gender bias. It's just that traditionally the research and is very skewed, in the male domain. And the gentleman, please forgive me for saying that. But when they're implants, the whole design is based on just whatever data points they have, and unfortunately the data points are not the same as for men
For something simple like a knee implant.
Exactly. And then hip implants, there have been accidents, in the sense that it was not designed for women's hips.
So what is the way ahead?
So that's why I was leading back to the point that now we've become aware and we have to do what we have to do.
But it requires money, effort, resources. Do you think there will be some resistance to putting more money into this new types of research? For example, if you're talking about hip and knee replacement surgeries, the companies which are working on this, do they need to now look at a completely new way? Will they be, incentivized?
I think both is not required. It's a right, so there's no question of incentivizing. Some amount has to be mandated. There was a time when we were really the COVID was really taking countries apart, and we were wondering what to do. Some countries almost mandated, vaccination. You couldn't say mandate, you couldn't really put it down as a law, but they almost mandated it. Like that, I think going forward, whether the drugs, when you look at the labels on the drugs, it has to kind of say that it has been tested for women's health also. Similarly for implants. And for a lot of, cholesterol drugs, for example, I don't think they've tested it on the women's genetic makeup. And there are tons of examples. I was sitting at an Alzheimer's program like a couple of hours ago, and it was very clearly discussed that for diseases like Alzheimer's, it's really not one size fits all. But whatever the drug discovery has happened, it so happens that the numbers are there, but the gender is not, it's not coming up in all these research documents. So that's the worry.
So that worry, Fleming, if I can ask you, how can this worry be ameliorated? I know you're in the foundation of a pharmaceutical company, but perhaps with the insight you have in your position, do you see medical research in companies like yours becoming more sensitive and making an effort to include gender in research?
Yeah, so first of all, thank you so much for the invitation. As I'm representing the Novo Nordisk Foundation, so more the foundation side, as you point out, as compared with the pharmaceutical side of the business, where I'm not so involved. But to your question, and maybe more generally starting out, we have a particular interest in cardiometabolic disease, so the whole non-communicable disease aspect. And to be honest, the knowledge gained, and we are a 100-year-old foundation, it's super biased. It's biased towards someone who looks like me, who's most likely the same gender as I am, who probably have been brought up in circumstances that are pretty well off, and so on and so forth. You could keep going on and on. So if anyone think that we have this objective, a broad base of knowledge under which we design our access programs, our treatment programs, our preventive programs, obviously we do not. So in a lot of the basic work on hypertension or diabetes and obesity and so on, we simply lack genetic insights. We lack representation. That may be women, but it may also be ethnicity, socioeconomic position, you name it. So let's face it, the basis for a lot of our public health action is super biased. And that's something we need to do something about, not just because we need to do something about it from a public health perspective, but we also need to do it from a moral, we have a moral obligation as a foundation to be willing to support research environments where women have a stronger voice. We fortunately see in a lot of the health sciences, more so than the hardcore STEM sciences, that women are gaining a very significant role. We also see it in STEM, we also see it across the board, but unfortunately not enough in leadership positions. So we have to work, because I think it matters that across the board there's a much stronger representation of women and greater diversity. Because you're probably biased, and we need to dilute some of that bias by having a much more significant representation, much more diversity. Someone like us, a large philanthropic foundation, colleagues of mine also, can do this through dedicated calls, thematic calls, building new alliances, support institutions. We have an obligation to do that from a medical public health perspective, but as mentioned, also from a moral. And also it goes sometimes to some of the ethical clearance procedures. Obviously, there's lots of trials that have not been done on women, because what about pregnancy? What about other issues that have been brought up to get an ethical clearance? Some of this makes no sense, to be honest. A lot of the protections we have included in some of the ethical clearance procedures, but there's a huge liability risk. At least that's being put forward in terms of the trials being conducted. So we also need to look at policy. We need to look at the environment under which some of these trials takes place, get a dialogue on lots of the insurance and ethical procedures, because we need larger representation. And honestly, when you look at some of the studies, they're so focused on those that can be maintained in trials, those that don't drop out, because that's very costly. So we keep selecting, that we are getting a well-designed, totally irrelevant study. We are masters of doing that. Anyway, that gotta change. I don't know if I answered the question, but it was something on my heart.
Paul, building on what he said, I think there's clearly, from public health perspective, a cost of not including women in medical research. And if we flip it, the cost can be turned into an advantage. What kind of structures are we looking at? You said that maybe a lot of design change is not required, but what is then required? What should be the role of each stakeholder?
I think from government, private sector, philanthropy, NGOs, and even universities, everyone has a role to play. I think we all recognize the problem, and we need now to switch to solutions, and also thinking about solutions that will work for the long term in a very sustainable way. Even starting by really empowering our young girls, encouraging them and supporting them to go into STEMs and education, etc. Because when you have a PI, a principal investigator of a research, if she's a woman, the kind of decisions she makes are different than men, right? Because she has lived experience. And then she needs to be a woman coming, because context matter, from the population we are considering as well. Because then she will take a different view on how to design the studies, etc. And then creating a critical mass of women researchers, etc. I used to be a researcher. I used to hire enumerators, and I'll do my best to have 50% of your enumerator people you are sending to the field to meet the women and discuss with them, because we used to do those very bad family planning research. You send a young man who has no clue to go to talk to a 40 years old about her reproductive health. Like, I hope we are shifting this. So that one, really that long-term training. And then there is the prioritization and putting women's health into the global agenda, and then also closing the funding gap. It is field that is underfunded, really putting money in the long term. Probably you've heard about the commitment of the Gates Foundation. This week we had our board approve our budget. For the year, we've increased our budget by 4%, and a quite significant amount of money will go to gender equality division and to support women's health innovation, and working with different partners to also advocate for other donors to continue to really fund women's health. Not only the solution, but also the translation into those solutions, into implementation, and working with government. We've been really impressed by our partnership with government of India and other government across the world, where they put those policies, take the innovation, implement them, not only as pilot, but at scale in a very sustainable way. This is how we'll really continue to all play and continue to push the envelope.
Great. Would you like to add something, Preeta, to this?
No, I think it kind of covered everything. I'm just saying that there is 49.7% of 8 billion is women. So I don't see an option. I don't think there's a cost. It's just a change in policies and mandate. It will evolve. You're not going to wake up tomorrow and say they're going to do that. But I think we have to move in that direction. And some, stringent maybe regulations are required, saying that, when a new drug comes into the market, or when there's a new implant or a device, that it has been tested on women also. So I think it's more, there's no point looking at the past, but I think going forward, we have to really put these checks and balances in. But from an economic, opportunity, since you asked that, we forget the fact that AI and digital has a large role to play. And there is an opportunity for, healthcare players, device manufacturers, those who are creating. Women need to take charge of their lives. And for a lot of those who have, where they have created the so-called apps, there is so much which can be done. And from a data science perspective, from a research perspective, there is actually an economic spin-off, and we have to look at that, and that might just pay for the extra cost of, changing the way we do things.
I'd like to take a couple of questions from the participants, but are there any examples of this regulation which can be seen as the avant-garde on this front, where you say the clinical trials are mandated to be inclusive and engendered?
It's coming out. I did not go through research and say, is it already there? But I know in dialogues, especially with, women have the propensity post-menopause for heart attacks, and they do have high levels of cholesterol. Cholesterol drugs are they are designed, but the cohort is not equal between men and women. It's just the numbers. It's not really gender based. And I know that the regulations are coming in where it says you have to do X number of women post-menopause. So they're designing it in such a way that the cohorts are more meaningful, and I know that is happening for sure. Even the diabetes drugs are becoming more and more gender, age, molecular biology comes into play. So in the research space, a lot more is going on. It's going to level 3, level 4 on the way they're doing things.
Super. Any questions or thoughts from any of you? Yes, please. Quickly introduce yourself too.
Hi, I'm Chitkala Kalidas from Bayer. I'm the Global Head of Oncology Regulatory Affairs. So this topic is very close to my heart. Just want to follow up on what Dr. Reddy as well as Dr. Conradson said about regulations. There is the FDA has introduced the clinical trial diversity guidance, which is actually in the US a law. And what that requires now is for sponsors of clinical trials to have a clinical trial diversity action plan. And if it is not submitted to the FDA, they could refuse to accept a file. And also the other populations that you mentioned, like pregnant women, these are susceptible populations that, thank you. The susceptible populations also need data. Of course, we cannot include these patients in many trials, but the preclinical data can inform how to handle these susceptible populations. But the important point being the clinical trial diversity guidance, which is very new, is not focused only on women, but it's about representation across the board. All of those segments of the population that are currently not included in the whole process, we have to show as sponsors what action we are taking to include them. And I hope as part of all of our efforts to include people facing disparities, the population of women will go up, as well as those who really need to be almost like athletes to participate in a clinical trial. We can look at people in their natural setting who don't have access to transportation, which is a big hurdle, that we can include all of those types of people and really conduct a clinical trial that is reflective of the real world. Thanks for the discussion.
Thank you. Any other question or thought? That was a very interesting input.
Maybe I can ask a question from Dr. Reddy as well as Fleming. I'm not going to put my colleague in the firing line. I'm Archana Vyas from Gates Foundation. So one question from me, as you think about AI, right, and I know that Apollo's actually invested a lot in terms of digital technology as well as AI. Is AI also not having bias? Is it a bias model that we are, and how do you remove biases to include, more gender representation when we look at AI for health? And Fleming, I know that you care a lot about human resources for health and capacity building. So as we are thinking about models that are focused on women's health, what are the capacities that need to be built within the health fraternity as well as frontline health workers, that the delivery of health services is equitable?
So, I don't really have an answer, to be true, because AI is something. It's almost like a faceless monster. So I don't know if it has a gender. I think it's what we feed into it, right? So it goes back to the basic fundamental point that have we fed in data which is equal to both? And we don't know what that data is. So we need to set right the things, which we do, and then the AI will probably then perform for us the way we need it. As far as workers and allied staff go, an orthopedician is just an orthopedician. And I'm saying this because I personally have seen issues happening with the knees and hip joints. So that's why I keep going back to that. Sports injury. They probably need, so we're not skilled enough to think of it from a different body or a different genetic makeup. So there is a bit of an issue, and I think because it's being flagged so much in so many fora, institutions will start saying that the way your clinical pathways, your protocols might be a bit different. So I think it's more about going forward, and it's not there yet. But then so many things were never there even 5 years ago, and now it's the norm. So it'll happen.
Just a few words on the AI, and you're right. So, and you're also right. It's of course about the cases. We are training models, and the input, of course, matters. And there are quite a few examples. Actually, India is becoming a super hotspot for the training of these models for AI, and something you would think would be fairly objective, like TB. The models that are now being trained have an underrepresentation of certain genetic makeup, certain ethnicities, and also gender. So we now have to focus and invest more in training these models so they actually are a lot more representative, because else we are missing out on diagnostics. So it is becoming a real issue. And for example, philanthropic organizations, but certainly also the companies that have available health systems, have these cases available to train models, need to revisit how we train, because they will become the authoritative models for diagnostics. On the human resources, fortunately, there are a lot of countries, and India is certainly one such country where curricula is being modernized. That goes for nursing, that goes for medicine, and so on. And that's a huge opportunity. Because it is more patient-centered. It is a more modern, not just on diseases, but also on thinking, preventive communication, and so on. So we have an opportunity to build the future workforce being more gender-sensitive, being more sensitive towards socioeconomic position, and so on, being more preventive in their communication. So I think there's many countries now modernizing their educational system. So it's now we need to support those institutions. That's faculty leadership for women as well. It's making sure that nursing also becomes a research discipline. And the curricula, the material, the way we train simply have to be a lot more gender and socioeconomic and ethnicity sensitive.
Thank you.
It is a huge opportunity.
Fleming, I'll have to interrupt you. Minister Irani is here, so I'll request her to please join us.
My
Thank you.
apologies, I'm late. The person driving the car was a man. He lost his way. Got stuck on the road above. I asked him, do you know how to get there? He said, no. I said, let me then.
Yeah, sometimes you have to leave the men behind, and just walk ahead.
Tell me about it.
So, Smritiji, we've been having a good conversation about engendering women in health research. The key thought I'd like you to share with us is, in a country like India and the growth economies in Asia, Latin America, and Africa, women have to play a very important role in economic development. But without the right kind of health inputs, it is, of course, a failed project. So in your view, how do you think policymakers can play a role to ensure that medical research, focus on women, becomes a priority?
I think that if we look upon women only as consumers of Medicare benefits, then that would be a very limited view of the true potential of gender and its participation in the healthcare ecosystem. To just contextualize it a little, we have today an active frontline healthcare force of 6 million women, and an additional workforce of the same size, which is just retired from public service, which means that we have the largest skill set in the world of women by women for women. One is that. The second aspect is that if you're looking at the healthcare systems, I look at women not only from the perspective of receiving more and more benefits as patients or consumers of a better healthcare system. I would like to see women at various layers of engagement. One is ownership of healthcare institutions. One such example is on the panel today. How many more women can become owners of such infrastructure across the country, which may not be only related to brick and mortar institutions, but also as more and more AI is infused in healthcare, how many more of those innovative practices that will transition into big scaled enterprises will then be owned by women? That is one aspect. The second is when it comes to research, children are not a vote bank. And hence, on the healthcare ladder, they are not only on the first step, in fact, many a times completely avoided. But when it comes to adolescent health, when it comes to child health, the burden of taking care of a child confronted with a disease or a medical challenge falls predominantly on the woman of the house. So if you're looking at it from a gender perspective, one, child health has to be equally given importance. The other segment is that we, as I said in my opening a few lines, have the largest skilled female labor force in the healthcare systems. How can we service the global needs better? Prime Minister Modi now has ensured that every district has a medical college, but complementing it is a nursing college.
Exactly.
We are expanding our facilities to ensure those girls who might not have access to medical education, let's say in their neighborhood, at least are facilitated when they migrate within that own state geography and then progressively go up the academic ladder. But how can we now enhance their skill set from a service segment with regards to global need? So if we just reduce healthcare and women from a consumption perspective, that's a great injustice. The cultural context of how the healthcare plan of Prime Minister Modi under Ayushman Bharat, which is being unfolding in India, is, I think, nothing short of history. Culturally, that was believed about us, especially in the global south, that we as communities do not discuss issues such as cancer of the cervix and cancer of the breast. They are taboo subjects. Menstrual hygiene products were never spoken of in the public space, let alone by men, but even by women. Now, for the first time in the history of any democracy, we've had a prime minister stand at the ramparts of the Red Fort and during his Independence Day speech speak about access to menstrual hygiene products at ₹1. Now, while it is a great medical information being given, but imagine the social impact of that dialogue from the national parapet. So if you're looking at healthcare, I think it, again, would be a limited view. If we look at it only from investment perspectives, it would be a limited view if we only reduce women to consumers, and it would be a limited view if we have a conversation bereft of the needs of children as well. One of the biggest exploding problems I foresee as a mother of 2 kids is the issue of adolescent health and not reproductive health, which gets often talked about, diabetes. And when this young generation grows older, what is going to be then the burden on the health ecosystem domestically, globally? While we all celebrate the world over the demographic dividend that we have, we need to recognize that there are economies in the world which are now burdened with the bills of geriatric care. How can we look at that segment? Because women are getting older as well, but then why not extend the help to men? So again, for me, what would be of great value is the conversation which is on these layers. But if I am to implore investors from an Indian context, I think if you look at the explosion of GCCs in India with regards to R&D, we have a fantastic story to tell, because that explosion, that growth is not happening in major centers. It's happening in tier 2, tier 3 cities.
Right.
And today we have close to 2,000 GCCs and 1.6 million people who are employed there. CB from CII often says that we've moved from the back office to the front office of the world. So COVID could tell the global community that we are the pharmacy of the world. Now, administratively, logistically, for the needs of MNCs, we've become the front office of the world. The issue is, as Prime Minister Modi says, no one should be left behind to accrue benefits or to accrue opportunity.
You know, there's a great point you made about women health workers and what a fantastic army we have. But it also sparks the thought that women research on women and women in research is equally important. We don't have enough women researchers. They bring a different perspective. Research on women is something that industry has to start moving towards. Do you think government has a role to play? Do you think regulatory bodies have a role to play here?
I will give you one of the experiments that I had the privilege of doing when I was Minister Education. The transition of girls from high school to technology institutions was only 21% when I took office as Minister Education in 14. The Prime Minister was insistent that we help and encourage more and more young girls in STEM.
Yes.
Today, we celebrate the fact that 43% of STEM graduates in India are women. But 2014, one of the challenges when we spoke to young girls as to why they did not gravitate towards STEM-based knowledge practices, they said that for competitive exams in the coaching industry, parents would rather spend on the boy than on the girl. So we did a small experiment called Udan. We took 500 girls across all geographies, across all cultures, religious diversity included. And we gave them a device preloaded with not only curriculum, but also additional learning aids. But we didn't leave it to a digital interface. We had subscribed to every young lady, either a college professor or a school principal or a retired teacher, and then simultaneously had a 24/7 helpline. Of the 500, and I recently in a G20 Indian presidency meeting met one of the young girls, 499 went to technology institutions.
That's brilliant.
I was looking for that one person who didn't. But I was looking for that one girl who didn't.
Right.
I did meet her. She said, I discovered I don't like maths after all, and I went for history. So the transition to higher education was complete.
Right. True.
So when you talk about women in research, the minute we did this, the other conversation that threw up the challenge for women is those who wanted to pursue PhDs were leaving their education behind the minute they got married and moved cities. So we made their credits applicable across the country. And today I proudly say that the number of women who do PhDs has gone up by 99%. So I think it's, as they say, God is in the details. Modi is looking into God every day.
Preeta, do you want to add to this in terms of women in research? Do you see that happening?
No, I think with ISRO and our foray into space, it was a woman director who really launched the latest satellite. She was part of
What
it.
is fantastic about our space story is that it takes more money to produce Top Gun with Tom Cruise in it than it takes to take a mission to Mars. The fact that, yes, our project directors have been women is not the only cause for celebration. Our mission to study the moon, we've all had women leading it. For me, what has been a part of the excitement is the close to 16 satellites by students that ISRO has launched, which means that the female story became a story across genders, across age groups. That in technology now, we have women who need not conform to a Western concept of emancipation. This is homegrown talent coming from the poorest of the poor segments or the most humblest ones who have linguistically been challenged before. But maths is a great leveler and science is too. So I believe the impact of women succeeding is not limited to becoming inspirations for young girls alone.
So finally, we'll end here. But that pilot project you referred to, how can that be scaled up at
Well,
a
the
national
industry,
and perhaps not just national, at a global level? Because this is a global challenge too.
I think that while today, if you look at access to education, in 2014, the Prime Minister was extremely keen on digitization of curriculum and digitization of learning materials. At that time, people scoffed at him and said, why? The pandemic, in fact, was a great explainer why. In the year 2023, March, as of last year, the learning lessons that have been indulged in digitally in my country are close to 5.5 billion learning sessions. There are today 12 billion plus QR codes of only learning and academics in India. So how can I think, industry contribute? Make devices affordable. There is a PLI scheme which is underway, which promotes indigenous manufacturing of the digital devices which are a rage in the world. The Apple story and its manufacturing capacities in India and the mobile success in India is well known. But if you look at it from a prism of gender, education, empowerment, today there is access to curriculum, there's access to learnings. We now need to make devices more affordable. So India is open for business on all those fronts.
Thank you. With this, we'll end. I think I have to thank you, despite terrible men driving you. I hope you can meet your next appointment much better.
It was just one man.
It's usually that one man. So, but thank you.
This is the only time when I don't disagree.
Thank you. Thank you. But I'd like to thank all our speakers, Professor Fleming, Paul, Preeta, for joining us, and all of you. And we mentioned earlier when we were beginning that this success shows that we need a bigger We Lead Lounge next year. Thank you so much.
Thank you.
Why don't you come in?
All right, look everywhere. Yeah. Say cheese. Thank you. I hope I don't have cross-eyed looking. Did you want to put it in?
Can you imagine at that time there were so many names here?
I have presented a new book. It's on the fifth industrial revolution, which includes social activism and sustainability changing business models. I hope you will find it interesting.
Women can propel change. But what propels? The share of women in executive positions in India has also increased steadily. A survey revealed that women's participation in the MD or CEO's roles in India has reached 55%. Studies prove that women's leadership styles are more transformational, participative, and inclusive, leading to increased productivity, enhanced collaboration, and improved fairness. Yet, only 10% of Fortune 500 companies are led by women, and only 28.2% of cabinet ministries globally are headed by women. The gender gap in leadership persists globally, not due to a lack of ambition amongst women, but due to a combination of other factors, which our panel will explore and deliberate on.